Tomorrow Halloween is coming
Yes,
up.
we do our lives on Tuesday. I'm sorry, on Tuesdays. So because tomorrow is Halloween, we decided to dress up a little bit.
Yes.
All right.
And tomorrow, you're all welcome. You can come to our office to get your candy, trick or treats. Yes.
I will be here. I'll be here.
So can anybody guess who we are?
Yes, please post it as soon as you
Let's
guess.
see.
Yeah,
anybody
if you
can
can
take a
guess.
good guess.
We're incomplete, but
What's going to happen if they guess correct?
oh,
Yeah.
$500.
I was thinking about to give them the Botox.
Oh, we're gonna do Botox, yeah.
Yes.
$500
For
off
the
any
first,
procedure.
yes.
Oh, okay.
And Botox too.
Yes.
do both.
For
Very
the
good.
first person to to guess correctly who we
Here
are.
we are. Other than the name Dr. K. And we're very close to that character.
Okay,
Yes.
so
Alright.
So today we have a very interesting topic, and of course you can post your questions on anything you'd like. We're still going to go ahead and answer your questions, but we wanted to talk about revisions today. I think the most common questions is about liposuction revisions, and I have a question here, doctor.
Okay.
Okay. It says I have fibrosis left from liposuction. How do I get rid of them?
Okay. It's not easy. How long after liposuction got the fibrosis?
10 months ago.
10 months
It's
ago.
been 10 months, yes.
Okay. But first of all, I suggest just wait another 2 months to make sure it's 1 year after your liposuction. And then, then depends on fibrosis. Sometimes we can use the Kenalog, adding that or steroids to the tumescent fluid, and more about to soften it up. But again, this is something that your plastic surgeon should examine. And by the way, how is the volume? Is it okay, or should I speak louder? Because my voice goes down, down, down. All right. So yes,
Let us know.
if your plastic surgeons say that could be a help after examining you, then adding some steroids to tumescent fluid and just softening up that could be helpful. Yeah. But fibrosis is a part of the healing process. No, by the way, could anybody guess who are we today? Anybody could guess?
No, I'm still reading the comments right now. So
Okay.
as we mentioned earlier, if anybody can guess, we are missing one little particular character.
Yeah, you are not completed yet.
So the first person to guess does get Botox. Correct?
Okay, yes,
Yeah, okay.
yes. For
To
one
guess-
area.
To guess correctly.
Yeah. Not the whole face, but from one area. Yeah, for one aesthetic unit.
Yeah.
I'm making the next one, yes?
Yeah.
Should I give them hint or not yet? That's it. No, just one. No, see, let them try.
How are you going to say?
Whenever you want a hint, just post that you need a hint. Spice. A little bit. No, we'll tell them later. Give a hint, yes.
Okay.
Okay.
I have another question. Do we
Okay.
have any questions, or want
We
to
have
say
people
hello?
just logging in right now. We do have a question saying, what's your opinion on breast implants?
Yes. It's good when there's indication.
Yeah.
Breast implant is the most common procedure in the plastic surgery, and thousands and thousands of the people they get that surgery. When there is a right indication and the person should be 18 if he wants to go with a saline implant minimum, and should be 22 minimum if he wants to go with a silicone field implant. Then after you exam, is a very good, fast rewarding. Because keep in mind, breast is the most important organ for females. It's the most feminine organ for the ladies. Yeah, that was a general question. What's my opinion?
Call us. We have a special promotion for November and December for saline implants. If you'd like more information, go ahead and give us a call.
Oh, okay,
Yes.
very good.
We have someone, her name is Mia Dolls. She says, I don't understand any word, but I love you. So her language is French.
Oh,
But she wanted to say hello. Yeah, how do you?
Hello.
But it's not, English is not her language, but she loves it.
she
wanted to say-
speaks French.
She says, I am French, so it's
Merci.
not my language. Merci.
Merci beaucoup.
Oh, okay.
How about that? That French was for you.
That's nice. Yeah.
Okay. Another question, and it's related to liposuction as well. And Can inner thigh liposuction be fixed from uneven results? This is from revisions.
If that happened after the liposuction and the skin has a good tone, and still there is some uneven result because of some fat pocket left, or yes, that could be revision. But keep in mind, again, I repeat that because when it comes to revision, I always keep saying, if you can wait and there is no disaster that should be taken care of, it's better to wait for 12 months. It's better to wait for the healing and healing get completely matured than before you make a commitment for another surgery. The result is going to be better. But if you want to do a procedure prematurely, it's a kind of promise that you're going to make it worse.
Yeah, you don't want to interrupt the healing process.
Exactly. You don't want to work on a moving target. If you can get that target fixed, then do work on it. Yeah.
Let me know if you have any.
Yeah, my tooth connection is a little bit.
Oh, really? That's all right.
Yeah.
Did we pay the bills? The connection is not
We're
disconnected.
gonna wait a little bit more.
Okay.
Yeah. So then. Yeah.
Is it time to get completed?
I
Make
think
it easier.
I think it is time.
Yes.
Yeah.
Let's
We have
let's make the
our little-
crew completed. Maybe
Oh.
make it easier to take a guess for our viewers.
Oh yeah. Okay.
All right.
Perfect.
Okay.
So we're
Listen
gonna
up.
look back to whoever did guess correctly, but let's see if we can get. Do you mind coming in here?
Leslie.
Yeah.
This is Bubbles.
Yeah.
Oh.
Hi.
Hello.
Let's see if we can
Hi everyone.
scoot
All
in.
right. Now it's completed.
Yeah.
See if you can guess.
I wonder if you're able to. Is she in the shot right here?
Uh-huh.
There we go.
Yes.
All right.
Oh.
There. Okay.
Oh, wait.
Closer.
No.
Yeah.
Liz,
From you,
we're all
from you, from you. There we go. Very good, very good, very
So
good.
if you haven't guessed already, we have Miss. Yeah.
Yeah, that's a hint.
Yes.
That's a hint. That's a hint.
We have Miss Buttercup,
Buttercup.
Uh-huh.
Blossom,
And Bubbles.
Bubbles,
Bubble.
and the
The
professor. Okay. Yeah.
There is a question here, and you want me to can you read it? I
Yeah.
think you have it.
Yeah.
Mhm.
So, okay. So they're asking your opinion on the breast implant illness. So,
I would like, when you posted that question, if you have a specific question about the illness, I can address that more specific. But if your question you are asking about leaking of the implant, or which is one of the possible complications of the implant, keep in mind that breast implants are not the lifetime instruments. They might need some sort of revision at some point. The chance is not too high, but when you ask specifically about the leaking of the implant, depends. If you go with the saline field implant, first of all, they are not dangerous, that they doesn't cause the cancer or any big problem that we cannot solve it, or we don't know about that. No, it's very well known. The leakage of the implant, remember, whatever is going to make a big difference between the saline field implant and silicone field implant is the content of the implant. Just imagine implant as a bag, has a shell, and the content inside that. When it's saline filled, which is saline is the IV fluid, when the saline filled implant leaks, the diagnosis is so easy. In average of 2 weeks, you will notice you're standing in front of the mirror, you will see one side is flat. So the diagnosis by standing of the mirror, if you're standing in front of the mirror, look at yourself and see the two breasts of the same shape, and then one of them is not flat, that means there is no leakage. Simple like that. But when it comes to the silicone filled implant leakage, is a little bit I don't want to say complicated. It's a little bit more tricky to find out, because you cannot simply standing in front of the mirror and look at yourself and say, okay, I have leakage or not.
right.
You have to be examined by a doctor, and most of the time you need to get a test of the MRI or ultrasound. In those cases, especially MRI, which is sensitive 98%, can tell you if there's a leakage or not. And again, when it's leakage, it doesn't matter saline or silicone. The answer is so easy. Go back to the lab, replace it with a new one. Remember, they come with a warranty through the factory. If you get it in the States, I don't know about the Europe or outside of the States, but at least in the States, when we go with the FDA approved implant. If there is a leakage, there is a lifetime warranty with that. The warranty is, it has details. I don't want to get to the details of that, about that. You can call us, we can give you more information. But the factory is providing you implants for free. Am I correct? Or they changed the policies? Is it still the same?
Yes.
Very good. All right. Okay.
It's a lifetime warranty.
Nobody could guess? Yeah.
I'm checking right now, but I if we can stop a little bit and just say hello to everyone
Sure.
that's been waving or saying hello to us. I have Theory Cesariosis saying hello.
Hello.
We also have, so if you can let us know how the volume is, if we're good, if we were, you can also comment where you're seeing us from. We have Drea17, she's waving
Thank you
hello.
for joining us.
Yes, hi.
Thank you.
We have Jats1209 giving us a thumbs up. We also have,
We give you thumbs up
yes,
as well.
we have, we have Princess Cakes. She's putting the little heart emoji with the heart on the eyes. So I'm pretty sure she's like, look what you see. So yeah, so if we can just
Anybody
just
from Chile?
from Chile, no,
No,
not yet.
oh my
I
God,
know,
yeah.
waiting for her.
She's
Yeah.
always tuning in.
Yeah, she's always there, so it's good.
All right. And nobody guessed so far. Let me
Not
give
yet.
you another hint about this customer group. I'm making the Power Girls.
Yeah.
A little bit sugar,
How?
Sugar and
chemical
spice.
eggs
Sugar,
and spice.
spice,
Yes.
What was
Everything
the-
nice.
the
Chemical
eggs.
eggs,
Yeah.
sugar, spice. Nobody could guess. Nobody wants the free Botox from one area. The time is passing by. Nobody. Okay. You still have time. You can find it. You can do a little bit cheating. Go online and cheat. Okay, I cannot give hint anymore. All right.
Okay.
Let's go to the next question.
Let's go. I'm trying to go for like the tummy tuck revisions.
Okay.
Oh, we have Princess because she says she loves the Powerpuff Girls.
Oh.
Yes, she guessed
okay.
it. So that's her. You won.
You won. Where,
Yeah.
where are you contacting us? Where are
Princess
you?
Cakes.
DM us.
Okay.
Yeah, she says I love the Powerpuff Girls.
Okay.
Yay.
So you won Botox for one area. So if you don't want to use it, you can pass it to a friends or family that you think that they might want to use it.
Yeah, so DM
Yeah.
us and we'll contact you after the live.
You need to come to office together. We cannot
Yes.
come to you.
We want
Where-
to see you. We want
Yes.
to meet you. Where are you coming from?
Okay.
Let us know. Do we have another question?
Yes. So
Okay.
Dr. K, patient had surgery about a year and a half ago,
Yes.
and is complaining about extra volume on the sides.
Okay.
Dog ears.
Okay.
When do you recommend to, or how would you fix the dog ears?
The dog ears treatment is just surgery. You have to get a revision, and most of the time you can fix that under local anesthesia. Even you don't need to go under general anesthesia. Sometimes you need to get some liposuction at the same time. Depends because dog's ear is not it can be different in different people. It's a general term. Sometimes it's a little bit amount, and again, just wait for 1 year. Make sure the healing is completed. It's not a disaster. You can wait for the better result. I would say just wait, and it's so easy to fix.
Can we further explain what a dog ear is? They're probably
Oh,
wondering,
yes.
like, my ears? Like, what? For a
No,
dog?
not
They
the
don't look
dog's
like
ear.
a dog.
Look at the German Shepherd's dogs. A little bit pointy on top. You know,
Yeah.
Mr. Spike. You
So,
know.
what is a dog ear, Dr. K?
Yeah. Okay.
For those of us who probably
How
don't
should I
understand.
do that?
Yeah,
Okay.
probably.
So.
Usually it comes after having a
Tummy
tummy
tuck,
tuck, right?
yes.
Okay.
It's not uncommon to see that. I would say sometimes the incision in one end is a little bit bulge at the end. So that is called like a dog's ear. So that's so easy to fix it. Go back there, remove that, and sew it again.
See if I can see that right there.
Yeah.
So that's like right where the incision is, right here.
It's like
Yes.
more volume on the side.
Imagine, yeah, this is
This
the
is the
incision
incision.
line, yeah, and this is the one side with more volume.
So that can be a little bit like, you can see it with the clothing and everything.
Yeah, it depends. If it's sometimes it's a significant amount, yes. Even with clothing, you can see some pouching that is not pleasant. We want to make it smooth, yeah. Yeah, in that case, I usually go back to your plastic surgeon and can do that. Or you can come to us anyway. Yeah.
So Princess Cake says she is from Maryland.
Oh,
so,
great.
Yeah.
So you cannot. Are you planning
to come to California anytime soon?
Or you, if you know anybody in our area in California wants to use and you'd like to pass the gift to them?
Yeah, that'd be nice.
Wait, when is it going to be the expiration of this gift? We didn't think about it.
That's true.
Yeah.
Within 30 days. I mean,
24 hours?
30 days.
Or is it already, expired.
Within 30 days, of course. Have some time before the holidays.
Yes.
You can give it as
No,
a gift
we can keep it for you.
Yeah.
We keep it for you, don't worry. Yeah. Alright.
Okay, I have another question.
Yes.
And it says, should I have a Brazilian butt lift and tummy tuck revision at the same time, or separate the procedures?
Is possible. It's possible. You can do it at the same time. But the most important thing is when we do the BBL, keep in mind that you're transferring the living fat cells. So you need to protect the fat cells. You need to void pressure from that area. So the first question comes to the mind, okay, how am I gonna sleep after the surgery? Because I've got the cut in the abdominal area, so I cannot, it's obvious I cannot. If it's a revision, most likely you can lay on your stomach. But still I had cases that do the tummy tuck and BBL at the same time, and that's a good question. I have to be kind of the hunch over, not to put any pressure, not to lay on the stomach, not face down. At the same token, I don't want to put any pressure. This is exactly your surgeon should teach you and show you how to be able to be on your back and transfer the pressure from the buttock area to the lower back area. So not to put pressure on the precious fat transfer to the buttocks, because you want to keep them alive. But the answer is yes.
I think it depends on some of the patients, like with their pain tolerance too, right? Because some people, they're expecting, oh my gosh, I'm going to have all this pain and everything, and when they finally have their surgery, they're like, well, it's not that bad. Yeah, so it's something you
But remember what we do at the end of the surgery, always I block the nerves.
That's true.
I give them the tap block, and my patients in the recovery room don't feel anything.
Right.
I say, okay, wait, and it's 7-8 hours gradually of pain, but immediately after the surgery in the recovery room, nobody has pain.
That's
because I do the tap block for them. Is a good method of the controlling pain right after the tummy tuck procedure. So.
That's good.
Yeah.
So Princess Cake says she'll see if she can come and visit us.
Very good, very good. When?
Make sure that's your first stop. Just come here and I want to meet you and give you some Botox.
Princess K, yes.
Yeah, Princess Cakes.
Good. Okay.
I love how she was able to.
It seems you don't want to give up your present to anyone else.
Yeah, she's like,
we'll
it's
save it
fine.
for you.
I'm coming to see you guys.
All right.
I didn't realize how it's like hot to wear a wig.
Yeah. When you wear a wig, it's different. Okay.
It's cute. So we have our skin specialist here, our esthetician.
Yeah, with Bubble.
And so if you have any questions on skincare, and you can come in for a free consultation with Leslie to see what she would recommend for you. She does facials, hydrating. Well, you can go ahead and
so we can do hydrating facials, anti-aging, some acne. We've been doing some peels. So we've had a peel event. If you missed it, we'll have another one December 6th, right? So we're having another peel event.
Starting at 4:30.
You can go ahead and call if you have any questions, and hopefully I can meet you guys.
So what can someone expect? So they're coming in. What are they gonna?
For the
anything? Say they don't know what they want to do.
Okay. So first, I like to get a little history from their skin. Maybe if they've ever gotten a facial before. Are they on any maybe acne medications? Are they allergic to some ingredients that may be in the products? So that's important. So the consultation is very important before. And then after for a facial, depends on what they want to get. Like a hydrating facial, if they're maybe like our anti-aging facial is good for like wrinkles and stuff like that. If they have acne, I can do an acne facial. So it just depends on what their skin type is and what they're looking to improve.
And after the peel, I think the skin is going to be ready to get all the products inside.
So peel is a good way to like
Yeah.
start, especially the stimulator peel that we have here. It's a good way to start to get like a good regimen going for your skin.
Especially now after the summer, a lot of people have been laying out in the sun, so this is the perfect time to get a peel.
Let's see, how long does it take for them or for you to do the peel?
For peel, it's about 30 to 40 minutes.
Okay.
Yeah, it's not too.
And any downtime after that?
It depends on the peel.
The peel that you recommend, the 3
so
peels.
The 3-step peel, that one's it's a while, so you're gonna be really flaky. When you're flaky, I recommend to trim, not to pick and pull.
Okay.
You can scar. But there's also peels that you can do like on your lunchtime, like the stimulator peel here that we have. It's like a lunchtime.
Lunchtime, yeah. Okay, so
Yeah.
definitely the day after you can go back to work.
Yeah.
Not that much redness. So.
No.
That's good.
A little pink after, but it goes away.
Yeah. The peels is actually removing a layer, a very very thin layer of the skin, because we constantly regenerating and regenerating the new cells. So the peel is gonna let you remove the dead and old layer of the skin and let its name is on it, stimulating to make a new layer of the skin. So the new skin, the baby ones coming out, is fresh. And that's the whole theory about that. And when
that's how you stay looking youthful and having great skin.
Well, with all of that going on, does it hurt at all?
The peel?
Yeah.
I mean, sometimes depending on how strong it is, it might sting, but not too bad.
Not too much.
Yeah, it's like the pinprick is like a burning, like a tingling, a little bit of small tingling.
But it's tolerable.
Yes.
But that means it's working. I mean, you should feel a little bit.
I want to be able to feel so,
Yeah, we had about 8 people having a peel that day. And it was, it was a lot of people. Everybody was happy. So far, everyone's had given us a good feedback on.
You started around 4:30 and then you finished 8.
Yeah, we finished around 8. Yeah.
Wow.
Yeah.
Okay.
So
I was not here.
No, everyone got a peel to make sure that everybody got a turn.
If you're looking to just relax and have a facial and be pampered,
it's skin evaluated.
Yes.
So that's good. We have Paola. She's saying with the little heart emojis. Hi. Little smiley face with the heart. I think
someone asked, does that hurt? Princess Cakes.
Was that referring to the peel or the Botox? Because I know she's the winner.
Yeah, none of them actually.
No, neither hurt. Yeah.
Yes,
Yeah.
it's not that bad. By the way, we don't have too much time left. It's
we
about
only have
3 minutes.
minutes.
Yeah.
Any other questions, or we have to wrap it up, or what do you want to do? Yeah.
Yes, we can. Call us for the special for breast augmentation for the month of November and December.
Just November, December. Okay, it's the end of the year.
And if you're interested also in coming in for the event, I know for sure I want to attend to that.
Or just get your skin evaluated.
Yeah.
Very good, very good.
Thank you for joining us every week.
Stay safe.
Halloween.
Happy Halloween.
Check your candy. Check your candy.
Yes. Actually, if it's okay to ask everybody, like, what are you dressing up as? Clearly, you see us here as the Powerpuff Girls. The professor.
Yeah.
So, what do you have plans for this Halloween? Of course, it's during the week, so everybody has to go to work the next day.
Yeah. I'm here for safe candy tomorrow.
Yeah. So, if you guys want to comment what you're doing for Halloween or what you're dressing up as.
Send us pictures.
Yeah, we want to see that.
Yes.
That's so cool. Yeah.
Very good.
Thank you.
All right. Thank you.
See you next week.
See you next week.